Jones. The doctor ordered a Foley catheter insertion for urinary retention, so we're going to go ahead and do that. I'm going to go ahead and have you verify your name and date of birth for me. Okay, perfect. And then are there any allergies that we should know about specifically to iodine? You do? Okay, perfect. And we will not be using that. So first, I'm just going to bring it up a little bit. Alright. So I'm going to bring this and cover you up here first.
Testing bone connection and air conduction. Air conduction should be longer.
Okay. And I'm going to bring the blanket all the way in here. And I'm going to bring your knees up a bit. Perfect. Is that comfortable for you? Okay, perfect. So I'm going to place checks underneath you just to keep the bed dry. We're going to go ahead and get you cleaned up over here. Outer. Alright. You did great. You doing okay? Alright. So give me just a few minutes to get all of my equipment set up. And we will get started. Okay. This bag set up for garbage. I'm gonna raise that bed well. I'm gonna put that right there by your hand if that's all right. And do you have any concerns or questions about the procedure while we get set up here? No? Okay, perfect.
Okay, now we're going to move on to the functions. I'm going to say three words to you. Have you repeat them right back? Or four words. Have you repeat them back to me or call them later? Dog,
Alright.
we're going to put breakfast this morning.
I'll try to.
I'm gonna place this.
Where did you go to elementary school? Really? Is your brother? Nuh-uh. Tell me about it.
Alright.
Anyways, repeat those four words.
And we don't need this drape. So I'm gonna place it over there. Okay, so we don't need this. And you mentioned that you were allergic to iodine, so I'm going to go ahead and get rid of that as well. And that. Go ahead and separate my cotton balls. And go ahead and soak them. Alright. I'm going to place some lubricating jelly in the tray.
Can you count from 0 to 50?
And we'll place the catheter tube
Now, I'm going
also
to
in the jelly.
test your proprioception, which is kind of body knows where it's at when your eyes are closed. So I'm going to have you close your eyes.
Okay. And I'm just going to go ahead and clean you, okay? You may feel me touching.
I'll take your feet, touch your Oh gosh, I need a. Yeah. Now I'm gonna have you close your eyes again, and I'm gonna hand you an object. And tell me what it is. I'm just gonna use extra large.
So I'm gonna go ahead and place the catheter now. So you might feel a little bit of pressure.
I'm gonna draw a number. And you tell me what it is.
Just go ahead and keep taking deep breaths for me, okay?
Still closed.
We're gonna insert 2 to 3 inches, and then insert a little further. And now we're gonna inflate the balloon. Once we see, we would stop pushing once we see urine, and then insert 2 more inches. So I'm going to inflate the balloon. You doing okay? Perfect. You're doing great. Release that. And now I'm gonna pull. And there's resistance. All right, you did great. I'm gonna go ahead and hang the bag. And I'm also going to attach this. I'll get rid of garbage here. Now I'm gonna also attach it to the leg. Just so that we don't see any tugging or pulling. It can be pretty uncomfortable. Alright, you did great. I'm gonna go ahead and swap out my gloves. I'm gonna get my garbage collector here.
Alright, now place your finger on your nose. I'm gonna have you tap my finger and then return to your nose. Sorry. And then can you bend your heel up your shin? I'm gonna see anything before I move on to.
I'm gonna go ahead and dispose of all this.
I'm gonna have you walk closely along, walk back to me.
Alright, so you are all finished. You did great. I'm going to lower the bed. We're going to cover the patient back up and replace them in the normal position. Pull the blankets back. And we leave. And then come back for removal. Hi, Mrs. Jones. We're going to go ahead and get that catheter taken out. This is going to be much quicker and much more comfortable than the insertion. Can you go ahead and verify your name and date of birth for me? Perfect. And I'm going to also just I would place the chucks underneath and empty the bag. And now I'm going to pull it back up here, making sure to keep it below the level of the bladder.
Oh my gosh. Yeah, whoa. Okay, yeah, so you so made that like well in time.
Alright. I'm going to go ahead and reattach this to deflate the balloon.
Yeah, okay. Yeah. And then for the Romberg test, it should be facing away. Okay. I mean,
Alright, do you have any questions about removal or anything? Okay. Like I said, it'll be much quicker, much less painful. And when I remove, I'm just going to have you take a big deep breath in and release it out like you're blowing out birthday cake candles. Alright, we're almost there.
the only two things that I forgot were tear, saliva, taste, balance, and eat. You forgot the speech and rise of the palate.
Alright, and we're just going to go ahead and remove. Ready? Big deep breath out. Alright, you did great. Alright, I'm gonna go ahead and get all this thrown away. And would you like me to clean you up down there? You're all good? Okay, perfect. We're gonna get you covered back up. Place your legs back down. Cover you back up. Alright. The call lights in place. I'm going to lower the bed for you. Do you need anything before I go? Alright, perfect.